Imagine this, your doctor says your blood pressure looks great. You feel like you've passed the test, but later on at home, you check it yourself to be sure, and it's high. And you check it the next day, it's still high. But at every doctor's office visit, they say it's totally normal. This isn't just a fluke. It's a medical condition called masked hypertension, and it affects millions of people who think they're in the clear when they're not. And most of them have no idea. In this video, I'm going to show you what masked hypertension really is, why it's more dangerous than you would think, and how to know if it's silently putting your heart and brain at risk, even if your blood pressure looks perfect at the doctor's office. Hi, I'm Dr. Brian. So masked hypertension is when your blood pressure looks normal in the clinic, usually under 130/80, but it's elevated when you measure it outside the doctor's office. It's like your blood pressure is wearing a disguise. Around your doctor, it behaves, but in your real life, during the stress of your work, while you're rushing through errands, or when you're sleeping, it spikes, and those spikes matter. It's the opposite of white coat hypertension, and if you haven't heard of that, try this video I did on it earlier. Instead of getting nervous at the clinic and making your pressure elevate, your body actually hides the problem while you're there. But when you're back in the real world, the truth comes out. And up to 30% of people with normal office blood pressure actually have masked hypertension. That's nearly 1 in 3. And here's the scary part. Your doctor might have no clue unless you identify it, bring it up to him or her, because the doctor readings look great. Why does this matter? Well, because masked hypertension carries all the same risks as full-blown, untreated high blood pressure. We're talking about heart attacks, strokes, kidney disease, and early death. And studies show that it raises your risk of cardiovascular events, heart attack, stroke, by 2 to 3 times compared to people with truly normal blood pressure. And most importantly, because no one sees it coming, it doesn't get treated. It flies under the radar, sometimes for years, silently damaging your arteries. So who's most likely to have masked hypertension? Well, people who have just borderline office pressure, like 120 to 129 systolic, people with diabetes, kidney disease, or what's known as sleep apnea, and obesity and smoking, high stress jobs. All of those put you at an increased risk of masked hypertension. And if you're an African American, your risk is significantly higher. Now remember, masked hypertension doesn't show up on a routine visit. You have to look for it. How do you do that? Well, get a good blood pressure cuff. Check your pressure at home twice in the morning, twice in the evening for 5 to 7 days. And make sure you have a cuff that fits. Try this video on choosing the right cuff that I did earlier. One way to even go a step higher and more accurate is ask your doctor for a 24-hour ambulatory monitor. That checks your blood pressure every 15 to 30 minutes while you go about your day and while you sleep. Ambulatory blood pressure monitoring, which is available by prescription from your physician, is the gold standard for diagnosing masked hypertension. And if your average reading is 130/80 or higher, even if your office readings are fine, that's hypertension, masked hypertension. If you catch masked hypertension early, you have options, and in many cases you can really help it or reverse it without medications. Here's really what will work, and all backed by very strong data. Food, DASH diet. The DASH diet can lower your systolic pressure by as much as 11 points. Just getting moving makes a huge difference. 30 minutes a day, aerobic movement, 5 to 8 point drop in your blood pressure. How about weight loss? Well, even 10 pounds can make a very meaningful difference. For each 1 kilogram or 2.2 pounds of weight loss, your pressure will decrease by 1. Sodium. Aim for less than 1,500 milligrams a day. The average American, more than 3,400 milligrams a day. Now, sometimes lifestyle changes aren't enough, but don't wait. Medications are safe. They're effective, and they can prevent irreversible damage. Because here's the bottom line. Just because your blood pressure is normal at the doctor's office doesn't mean you're safe. Masked hypertension is real. It's common, and it's dangerous if you miss it. So check your blood pressure at home. Ask questions, and if something feels off, don't ignore it. I'm Dr. Brian. If this video helped you, give it a thumbs up and share it with someone who you think might need it. And if you haven't already, check out my other videos on how to take your blood pressure correctly, because the first step in fixing a problem is knowing it exists.